So as we already know, the anti-PD-1 drugs and the anti-CTLA-4 drugs are not very effective in patients who have your normal garden variety colon cancer, which is the microsatellite stable colon cancer, and is 95% of metastatic colon cancer. So I think we're all interested in either trying to prime the tumors so they're more immunogenic, or look at combinations of other checkpoint inhibitors to increase the immune response to these tumors, which are immunologically cold, so to speak. And one abstract that was presented today that's very interesting is using a MEK inhibitor in combination with an anti-PD-L1. So that's cobimetinib with atezolizumab. And this is somewhat unexpected because the MEK inhibitor is basically a signal transduction drug that blocks RAS signaling, but it also seems to have a pro-immunogenic effect, and they showed in at least 2 patients with biopsies that patients develop more immune infiltrates and more expression of PD-1 and more expression of MHC-1 when you got the MEK inhibitor. So somehow the MEK inhibitor is becoming an immunologic booster of cellular immunity. So when they gave cobimetinib together with the anti-PD-L1 drug, the response rate was 17%. And that's really interesting because the response rate for either drug alone is 0. So by putting them together, though, we kind of gives us at least some hope that by doing combinations of other checkpoint inhibitors with anti-PD-1 or other drugs that boost the immune system or vaccines that boost the immune system, that somehow we may be able to convert MSS colon cancer to a more immunoresponsive disease.